Hi, I'm Dr. Tony Kappa. I work at the University of Illinois in the Shelter Medicine Department. And recently there's been some questions about whether or not spay and neuter procedures should be pursued at not only animal shelters, but also private practices in general. At this point, we're recommending that all elective procedures be postponed until further notice uh, and control of the COVID-19 outbreak has been taken care of. The reason for this is a couple. One is, we're trying to conserve PPE for our human counterparts so that they can protect themselves as much as they can, and so those resources should ideally be used in the human health field versus veterinary medicine where the procedure itself may not necessarily be needed to be performed at that time. The second is that it will decrease the possible transmission of COVID-19 from between staff and clients. So if you're working at a shelter, you're going to need support staff for those animals to be spayed and neutered. So those people are going to have to come into the clinic, and there's going to be more interaction between staff members, which ultimately can lead to transmission of the virus. Same goes for clients if they're coming in from um, uh, families in the area. Those people are going to have to interact, even if you do try to practice proper social distancing. There's going to be some interaction that could put staff at risk. And so, out of abundance of caution, it would be best to put off these procedures that aren't necessarily needed at the time. A couple of caveats to that would be if the procedure is needed because of a life-threatening problem. So if you have an animal with a pyometra or a dystocia that needs that procedure done at that time, those would be some time to consider doing the procedures. However, just your routine spay and neuter to animals being placed in a home, foster, or adoption isn't necessarily a requirement at this time. Although it is preferred for animals to be spayed prior to adoption, during this unprecedented time, those restrictions probably should be lifted so that you can limit the number of animals you have in your shelter. So utilizing your foster programs as best you can. And if you don't have a robust foster program, possibly reaching out to some rescues in the area that you might be able to partner with and find other people that would be willing to foster or even foster to adopt animals so that you can keep your numbers in your shelter low so that your staffing doesn't need to come in. As far as the spay and neuter portion of that, you can send out um, uh, vouchers with potential adopters or adopters that will allow them to come back in after this outbreak has been mitigated and come back in and perform those spay and neuter procedures at that time. Obviously, you would want to keep good records of these adopters so that you can follow up with them once restrictions are lifted to remind them to come in and spay and neuter their animal. So ultimately, we want to do the right thing as far as trying to limit how the potential for spread of the virus by limiting how many staff members that you might need to come in, as well as your interactions with clients and things like that. Good resources at this point that you can also look at would be the National Animal Control and sorry, National Animal Care and Control Association has a lot of good guidelines, and I'll put a link to that um, website that you can find as far as recommendations and things like that, not only for the spay neuter role of it, but also just um, your normal functioning as a shelter at this time. If you have any questions, feel free to email me at kappa@illinois.edu. I'm happy to try to answer any of those questions.